Wait, a quick one. What if I told you that these signs might not be just old age, but instead the result of something that can be treated? Have you or any senior you love ever felt tired all the time, even after sleeping well? Or struggled with memory problems that just do not seem normal? What about a senior, who was so sick but no certain diagnosis, and it was concluded the symptoms were just because the senior is aging? If this sounds like what you are interested in, then stick around, because we're going to talk about a vitamin that is small in size but very powerful in what it does. First, I want to specially welcome our new subscribers to the family, and if this is your first time here, you are welcome. To our returning subscribers, you motivate us a lot. Thank you for your support. Now fasten your belt, because we are about to take off. The vitamin is vitamin B12. Yes, you heard right. Its deficiency has led to so much harm. Sadly, many older adults do not have enough of it in their bodies. And most times they do not even know it. That is what makes this topic so important. Vitamin B12 deficiency can cause tiredness, depression, poor memory, difficulty walking, and even nerve damage. The sad truth is many seniors suffer quietly, misdiagnosed or dismissed, when a simple B12 test could reveal the real problem. What is vitamin B12 and what does it do? Vitamin B12, also called cobalamin, is a water-soluble vitamin that plays a vital role in keeping our body and brain healthy. Even though our body only needs small amounts, that small amount is absolutely essential for life. Vitamin B12 is involved in several critical functions in the body. DNA synthesis. It helps create and repair the genetic material in every cell of your body. A red blood cell formation. B12 helps your body make healthy red blood cells. Without it, cells are misshapen and cannot carry oxygen well, leading to fatigue and weakness. Energy production. B12 helps convert the food we eat into usable energy. That's why a deficiency often causes exhaustion. Nerve cell maintenance. B12 maintains the myelin sheath, a protective layer around nerves. When B12 is low, this sheath breaks down, causing tingling, numbness, or even nerve damage. Brain function. B12 is necessary for concentration, memory, and mood. Low levels are linked to forgetfulness, confusion, and even depression. Another important point is that the body does not make B12 on its own. We must get it from the foods we eat or from supplements. The main sources of B12 are animal-based foods like beef and poultry, fish and shellfish, eggs and milk, cheese and yogurt. Because B12 is not found in plant-based foods, vegetarians and vegans are at higher risk of deficiency unless they take fortified foods or B12 supplements. The same goes for older adults, even if they eat animal products, because their bodies often stop absorbing it properly over time. Also, unlike some vitamins that are stored in small amounts, the body stores extra B12 in the liver. This means that signs of deficiency may take months or even years to show up. But once they do, the damage can be serious if left untreated. In summary, B12 may be small, but without it, your body cannot function properly. It keeps your blood healthy, your nerves working, and your brain sharp. That is why understanding it, especially as we age, is so important. Before we continue, hear these few stories so you understand how seniors suffer due to vitamin deficiency misdiagnosis. One 70-year-old man, a longtime vegan, struggled for years with worsening peripheral neuropathy. His hands and feet tingled constantly, and his hobbies became too painful to continue. Doctors were unsure of the cause. It was only after a long time awaited diagnosis and starting B12 supplements that he saw improvement. Within 2 months, the numbness and tremors began to fade. After 6 months, most symptoms had disappeared. His quality of life improved drastically, all because of one overlooked vitamin. Another patient, a woman in her early 60s, developed memory problems and extreme fatigue. Her doctors treated her for stress and early cognitive decline. Years later, she was diagnosed with pernicious anemia. By then, the damage was irreversible. Although B12 treatment helped her regain some strength and clarity, she was left permanently disabled. These stories are not rare. They reflect the silent suffering of many older adults whose health could greatly improve if B12 deficiency were recognized and treated earlier. Studies estimate that up to 20% of people over age 60 may have vitamin B12 deficiency, with many remaining undiagnosed. In nursing homes, that number may be even higher. Some estimates suggest 30% to 40% of residents have low B12 levels. A 2012 study published in the American Journal of Clinical Nutrition found that over 60% of seniors who began B12 treatment for deficiency showed measurable improvements in fatigue, balance, and mental clarity within 3 months. Another study in Neurology, 2008, showed that low B12 levels are linked to smaller brain volume and faster cognitive decline in older adults. The key takeaway is this: if something seems off, do not just blame age. Ask for a B12 test. Why low levels are common in aging. 1. Reduced stomach acid production. Older adults often produce less stomach acid, a condition known as atrophic gastritis. Stomach acid is needed to separate vitamin B12 from the proteins in food. Without enough acid, B12 stays bound to food and cannot be absorbed by the small intestine. 2. Decreased production of intrinsic factor. Intrinsic factor is a protein made by cells in the stomach lining. It binds with vitamin B12 and allows it to be absorbed in the intestines. Some seniors develop autoimmune conditions like pernicious anemia. Pernicious anemia is a condition where the body attacks the cells that produce intrinsic factor, thereby causing the cells to stop making intrinsic factor altogether. Without intrinsic factor, no matter how much B12 a person eats, they cannot absorb it. 3. Long-term use of medications. Many older adults take medications that interfere with B12 absorption. These include proton pump inhibitors, PPIs, for heartburn, such as omeprazole, H2 blockers like ranitidine, metformin for diabetes. These drugs either reduce stomach acid or affect the digestive process, making it harder to absorb B12 over time. 4. Digestive system disorders. Conditions that affect the stomach or intestines can also lower B12 levels. Examples include Crohn's disease, celiac disease, inflammatory bowel disease, a gastric bypass surgery. These interfere with the part of the intestine where B12 is absorbed. 5. Poor dietary intake. Some older adults eat less overall due to loss of appetite, dental problems, or limited access to healthy foods. Others follow vegetarian or vegan diets without proper supplementation. All of these factors reduce B12 intake. 6. Alcohol abuse. Chronic alcohol use can damage the lining of the stomach and intestines, further reducing B12 absorption and increasing the risk of deficiency. 7. Aging itself. Even without any specific disease, the normal aging process changes the way the digestive system works. The body's natural ability to absorb nutrients slows down. This includes vitamin B12. In short, older adults face multiple risk factors all at once: lower stomach acid, possible autoimmune changes, more medications, changes in diet, and aging digestion. All of these make it much more likely for seniors to develop B12 deficiency, often without even realizing it. Symptoms of vitamin B12 deficiency in seniors. Vitamin B12 deficiency in seniors can be tricky to spot because the symptoms often develop slowly and may be mistaken for normal signs of aging. However, recognizing these signs early can prevent serious complications. Here are the most common symptoms seen in seniors. One of the earliest and most noticeable signs is constant tiredness. Seniors may feel drained, even after a full night's rest. This happens because the body cannot produce enough healthy red blood cells without B12, leading to less oxygen reaching the tissues. 2. Memory loss and cognitive problems. Vitamin B12 is essential for brain health. Low levels can cause forgetfulness, confusion, and difficulty concentrating. Some seniors may appear to be developing dementia, but the real issue is a correctable B12 deficiency. 3. Numbness and tingling, peripheral neuropathy. B12 is crucial for healthy nerves. A lack of it can lead to numbness, tingling, or a pins and needles feeling in the hands, legs, or feet. Over time, this can progress to nerve damage if not treated. 4. Balance and coordination problems. Because B12 affects the nerves, especially those that help with balance and movement, seniors with a deficiency may stumble, feel unsteady, or fall more often. Walking may become slower or more difficult. 5. Mood changes and depression. Low B12 levels are linked to mood swings, sadness, irritability, and depression. This is because B12 plays a role in producing brain chemicals such as serotonin, dopamine, and norepinephrine that affect mood and mental function. 6. Pale or yellowish skin. B12 deficiency can lead to a condition called megaloblastic anemia. The red blood cells become too large and break easily, leading to pale or slightly yellow skin due to a byproduct called bilirubin. 7. Shortness of breath and heart palpitations. Anemia from B12 deficiency may make people feel breathless with even small amounts of activity. The heart may also beat faster to make up for the low oxygen levels. 8. Swollen or sore tongue glossitis. Some seniors may develop an inflamed or smooth tongue that feels sore or swollen. This can affect taste, appetite, and even cause burning sensations in the mouth. 9. Vision disturbances. In severe cases, damage to the optic nerve can lead to blurry vision or even vision loss. This is rare but serious. 10. Gastrointestinal symptoms. Bloating, gas, constipation, or diarrhea can also be signs, though less common. These symptoms occur when B12 deficiency affects the digestive tract's ability to function normally. The symptoms are wide-ranging and may affect physical, mental, and emotional health. What makes it difficult is that many of these signs are subtle and can be blamed on aging, stress, or other health problems. That's why it's important to be aware of them and take action when something feels off. Early diagnosis and treatment can completely reverse most of these symptoms. Why vitamin B12 deficiency is often missed in seniors. Before I forget, please like this video if you have gotten this far with us. Subscribe if you are not part of us yet. Don't forget to share this video to a senior and whoever might need the information. Despite being common and serious, vitamin B12 deficiency often goes unnoticed in seniors. There are several reasons why this happens, and understanding them can help families and healthcare professionals avoid misdiagnoses. 1. Symptoms resemble normal aging. Many symptoms of B12 deficiency, such as fatigue, memory issues, and slower movements, are easily mistaken for the natural aging process. When an older person complains of feeling tired or forgetful, people often respond with, "That's just part of getting older." This mindset can delay investigation into underlying causes like vitamin deficiency. 2. Slow and gradual onset. Unlike other conditions that appear suddenly, B12 deficiency develops slowly over time. It can take months or even years before noticeable symptoms appear. This gradual change makes it difficult to recognize that something is wrong, especially if the changes are subtle at first. 3. Inadequate screening and testing. Vitamin B12 is not always included in standard blood tests during routine checkups. Unless a doctor specifically suspects B12 deficiency or the patient reports classic symptoms, the test might not be ordered. This is particularly true in busy clinics or with patients who have multiple health issues competing for attention. 4. Misdiagnosis and overlapping conditions. Because B12 deficiency affects the brain and nervous system, it can mimic other medical conditions. It is not uncommon for seniors with B12 deficiency to be misdiagnosed with depression, early dementia, Alzheimer's disease, or general cognitive decline. As a result, they may be treated for the wrong condition while the real problem goes unchecked. 5. Lack of awareness. Both patients and healthcare providers may not be fully aware of how common and serious B12 deficiency can be in older adults. Seniors may not report mild symptoms, thinking they are normal. Some doctors, especially those unfamiliar with geriatrics, may underestimate the impact of B12 deficiency or overlook it in the face of more urgent concerns. 6. Nutritional assumptions. There is often an assumption that if a senior is eating regularly, they must be getting enough vitamins. However, even with a good diet, age-related changes in the stomach and digestive tract can make it hard for the body to absorb B12 properly. This means that someone can eat well and still be deficient. 7. Medication overlook. Many seniors are on medications that interfere with B12 absorption, such as proton pump inhibitors or metformin. These medications are so common that their impact on nutrient levels is often ignored unless specifically checked.